Okay. Now I will go with our topic concerning growth and development. This is cerebral palsy. Okay. So we will go with the definition and how to recognize cerebral palsy, why it is important to know about it, what are the various etiologies, classification, evaluation, how to investigate and manage. So what is cerebral palsy? It is a symptom complex encompassing a group of non-progressive but often changing motor impairment syndromes characterized by abnormalities of movement, posture or tone. So it is mainly a symptom complex which is characterized by any abnormality in movement, posture or tone. So the hallmark is motor dysfunction. Another definition, it is a disorder of movement, muscle tone, posture that is caused by an insult to the immature developing brain, most often before birth. So the causes can be perinatal, the damage or insult to the brain can be prenatal, perinatal and postnatal. Now coming to prenatal, it can be due to poor nutrition, intrauterine infections, maternal illnesses, teratogens, fertility problems, antepartum hemorrhage, any fetal thrombotic vascular event, prematurity, birth asphyxia, IUGR, jaundice, any type of hemorrhage, dyslipidemia, hypoglycemia, sepsis, postnatal causes, any kind of head injury, CNS infection, seizures, hypoxia to the brain, genetic causes, and neurodegenerative disorders. Now coming to these are the etiologies. Now coming to the classification of cerebral palsy, it can be divided into physiological or topographical. Physiological is according to the tone or the movement, spastic when the tone is more, dyskinetic, hypotonic when the tone is less, athetotic when there are athetosis, abnormal movement, ataxia, and mixed type. Topographically, which part of the body is involved? So it is divided accordingly. Quadriplegia when all the four limbs are involved. Hemiplegia, any one side of the body is involved. Monoplegia, any one limb is involved. Triplegia, three limbs is involved, which is very uncommon. Recently, it has also been divided into unilateral or bilateral. So these, as I told you, these are the types: hemiplegia, diplegia. Diplegia, legs are more involved than hands. Quadriplegia, all are involved. These are the abnormal movement type. Now, in cerebral palsy, the patient is definitely having that muscle dysfunction, but apart from the muscle dysfunction, there can be associated problems like mental retardation, seizures, behavioral problems, speech, hearing, language disorders, extrapyramidal and sensory impairments, feeding difficulties. Now, how to identify which type of infants or newborns need periodic assessment for developmental delay or cerebral palsy. These are the very low birth weight newborns and newborns admitted to NICU with any neurological condition with acidosis or showing persistent neurological signs or primitive reflexes after 3 weeks, global decreased density on CT scan, low Apgar, meningitis, persistent seizure, apnea beyond term, neonatal jaundice, converting into kernicterus, symptomatic hypoglycemia or septicemia. So how to diagnose this early? The warning symptoms can be lack of alertness. There is, parents may notice decreased mobility, increased abnormal movements or seizures, feeding difficulties, drooling of saliva, persistence of primitive reflex. This is very important. This should be done. Neurological examination should be done in every child on follow-up. So persistence of primitive reflexes, that is like fisting even after 2 months of age. Other abnormal signs are head circumference. It should be taken in every follow-up and it should be recorded properly. Social smell not attained, head control not attained, or any delayed milestones attainment is noticed. Seizuring. When we lift the child, there will be seizuring, visual and auditory impairment persistent of primitive reflexes. Behavioral signs, the patient can be extremely irritable or crying. There will be feeding difficulties, little interest in the surrounding, excessive sleepiness. So these are the associated things with cerebral palsy, but cerebral palsy should be differentiated from other things also, like isolated mental retardation, isolated speech disorders, slow progressive degenerative brain disorder, metabolic and mitochondrial disorders, neuromuscular disorders or muscular dystrophies. Now, for the assessment of muscle tone, as I have told, the hallmark is motor dysfunction. So we will assess the muscle tone by various parameters, by seeing various angles like adductor angle, popliteal angle, or scarf sign. So the assessment of neurological reflexes, as I told you, if the reflex persists beyond a time like rooting 3 months, which usually disappears by 1 month, Morose, Palmer, tonic, all these reflexes mostly if persisting after 3 months, these child should be evaluated for cerebral palsy or developmental delay. Now coming to the role of investigation, mainly the cerebral palsy, the diagnosis is clinically by assessing the muscle tone. Apart from them, there will be hypodensity lesions in the brain and the CT scan. There can be intraventricular hemorrhage or periventricular leukomalacia or any type of brain insult during fetal period or neonatal period can be seen. Brain imaging is useful for etiology and prognosis purposes. It will not change the line of treatment. CT MRI can show degeneration, migration disorders. Always do vision and hearing assessment in a child with cerebral palsy. Other investigations include EEG if there is seizure activities, EMG, electromyography, other laboratory investigations to rule out genetic and metabolic problems. And as I told you, vision and hearing impairment, speech delay, these should be assessed. Now, coming to the goals of the management, what we want from the goals, from the management of what we expect by managing cerebral palsy. So coming to the goals of management, our goal should be decrease. So this cerebral palsy is a lifelong problem in a child and with the parents. So our goal should be decrease in the complications as much as we can. Enhance and improve acquisition of new skills. So the management is usually multidisciplinary with the rehabilitation therapy, physiotherapy is the main, and motor training, prevention of contractures by surgery, management of feeding difficulties, education, speech therapy, anti-epileptic drugs if seizures are there, haloperidol for any abnormal movements. Other management techniques that have been emerged during recent years are alcohol phenol blocks, botulinum, the toxin A, plaster casting or orthosis for contractures, adaptive equipments, sprints are there, orthopedic procedures, selective posterior rhizotomy. Now, prevention of contracture deformity around the joint, which is very important part of physiotherapy in cerebral palsy. There should be good positioning and handling. Active movement should be allowed to prevent the contracture. Proper positioning by splint drugs or plaster or braces, and passive stretching. There should not be massaging. There should be passive stretching or exercising. Now coming to the important part of cerebral palsy, the main, as I told you, it is a holistic management, but main management is physiotherapy in addition to the other supportive management. So principles of physiotherapy encourage movement as normal as possible, use both sides of the body, follow the development, prevent deformities, attempt to break primitive reflexes as they interfere with attainment of normal milestones. So these are the sprint, these are the various positioning. Poor outcome is with quadriplegia, hypotonic CP, motor delay within 6 months, no sitting more than 4 years, not ambulatory, reflexes more than 2 months. Good outcome with spastic diplegia, early intervention, family support, potentially preventive strategies, preterm LBW prevention, birth asphyxia prevention with good neonatal resuscitation, management of infection in the mother, iron iodine supplementation, antenatal corticosteroid, prevention of IVH. Nursing responsibility is very important. Now, to ensure family support, the parents require counseling, education, parents association, and peer group formation. Counseling of the family is very important. Non-progressive illness, it is not a mental illness. It can be with the mental retardation, but it is mainly motor dysfunction. Cause needs to be identified. Holistic evaluation and care is needed. It is not inherited, not curable. Management aims at minimizing the disability to improve quality of the life. So social supporting system is very important, special education, social awareness, various laws and various NGOs. So to summarize, cerebral palsy is not so rare. It is caused by brain damage. There are different kinds. There are varying degrees. It messes with muscle, big and small. It can make you tight or loose. It can be different every day. There's no cure. The parents should be counseled properly. You should not feel bad about these children.